alchemy of the messy alchemy of true healing, a case against pharmakeia and the coercive architecture of societal control. Ladies and gentlemen, esteemed colleagues, and fellow seekers of human flourishing, consider the individual ensnared in the crucible of profound emotional and mental turmoil. Not as a broken mechanism to be chemically recalibrated, but as a being engaged in an ancient, alchemical process of release and reconstitution. The worst intervention, history and evidence now compel us to acknowledge, is often the summons of law enforcement or the psychiatric apparatus upon one who confronts their inner hell. For in that moment of vulnerability, what they require is not the imposition of help, but the sacred permission to be left largely undisturbed, to vent the accumulated shadows harbored within, to exude the damages inflicted by societal expectations, betrayals, and the relentless demands of conformity. True healing is not a sterile, pharmaceutical transaction, yielding immediate, visible results. It is a protracted, disorienting odyssey, one that is messy, non-linear, and profoundly uncomfortable, not only for the one traversing it but for all who bear witness. Behavioral psychology illuminates this through the lens of catharsis and emotional processing, the deliberate or spontaneous release of repressed effects. Anger, grief, fear serves as a purgative mechanism. Aristotle recognized catharsis in tragedy as a purification. Modern psychology echoes this in practices of expressive writing, somatic movement, or unstructured venting, which allow pent-up emotional energy to dissipate rather than fester. When society interrupts this with forced medication, it does not heal. It submerges the process, programming the individual that their pain is unacceptable, that darkness must remain hidden in compliance. The psyche learns silence over expression, control over authenticity. Pharmakeia, the seductive arsenal of psychiatric drugs, has never been required for genuine healing, and immutable evidence demonstrates it often exacerbates harm. Long-term studies reveal that, while these agents may blunt acute symptoms in the short term, they frequently produce dependency, withdrawal syndromes that mimic or worsen original distress, and irreversible neurological damage such as tardive dyskinesia, involuntary movements persisting years after discontinuation, linked to dopamine supersensitivity from chronic blockade. Meta-analyses and critical reviews, including those highlighting brain volume reductions and poorer functional outcomes over decades, indicate that populations with greater exposure to antipsychotics, antidepressants, and similar agents show higher rates of chronicity, relapse upon withdrawal, and overall deterioration compared to those who minimize or avoid them. Animal models corroborate neurotoxicity. Human epidemiology suggests that the epidemic of mental distress has not abated despite exponential increases in prescribing. In some jurisdictions, prevalence has risen alongside treatment expansion. This is no accident of pharmacology alone. It reflects a deeper dynamic. The pharmaceutical paradigm operates on a drug-centered rather than disease-centered model, inducing altered states that suppress rather than resolve underlying turmoil. Holistic and natural methods, by contrast, demonstrate verifiable efficacy without such iatrogenic risks. Evidence supports mindfulness-based practices, nature immersion ecotherapy, physical exercise, nutritional optimization, and somatic therapies in reducing symptoms of anxiety, depression, and trauma by fostering autonomic regulation, cognitive flexibility, and emotional integration, often with enduring benefits superior or complementary to pharmacotherapy alone. Behavioral psychology affirms self-directed growth through social support, journaling, movement, and community, not chemical suppression. Psychotherapy modalities emphasizing insight, relationship, and meaning-making yield robust effect sizes without the organ damage, liver, kidneys, neurological, or psychological flattening associated with polypharmacy. In Canada, this critique finds constitutional anchorage in the Canadian Charter of Rights and Freedoms. Section 7 enshrines the right to life, liberty, and security of the person, explicitly encompassing psychological integrity and the autonomy to refuse unwanted medical treatment. Supreme Court jurisprudence affirms that state-imposed interventions interfering with bodily or mental self-determination, absent strict adherence to fundamental justice, violate this protection. Forced psychiatric intervention, with its attendant coercion, risks precisely such infringement. It treats the individual's distress as a threat to be managed rather than a process to be respected, undermining the very security of the person it purports to safeguard. Society, in its reflexive deployment of the system, reveals its true orientation. not compassionate accompaniment but control. By calling authorities or insisting on medication when one exhibits the raw disorientation of release, observers signal that pain is intolerable, that the sufferer must be silenced, compliant, and medicated into a facsimile of normalcy. This act drives a knife into the spine of trust. The individual may later communicate, may even maintain surface relations, but internally, the breach is irrevocable. They have learned that those around them prioritize societal order and pharmaceutical expediency over authentic witnessing. Research on involuntary treatment underscores this erosion. It heightens trauma, fosters distrust in care systems, and correlates with worse long-term outcomes, including elevated post-discharge risks, without clear evidence of net benefit in non-emergent cases. What then should society do? Nothing grandiose. Simply ensure the person is alive and breathing. Periodic, non-intrusive checks that affirm existence without judgment or intrusion. Offer presence if welcomed, but withhold the coercive apparatus. Recognize that true healing admits no quick fixes. Pharmaceuticals create the illusion of rapid stabilization by altering psyche and suppressing expression, yet they defer and deepen the underlying work. The process demands time, weeks, months, years of integration, during which discomfort radiates outward, challenging observers' tolerance for messiness. This is the case for radical personal sovereignty in healing, a stance against a society that weaponizes care to enforce conformity. Healing looks like tears that flow unchecked, rage that finds voice in safe solitude or trusted circles, darkness that surfaces and, through release, transmutes. It is uncomfortable, yes, for the healer navigating disorientation, for witnesses confronting their own fears of chaos. Yet it is the only path that honors the immutable truth. Pharmaceuticals were never the requisite engine of recovery. They often mask, distort, and control. True growth emerges from within, supported by natural rhythms, breath, movement, connection to self and world, underpinned by the Charter's promise of liberty and the psychological evidence of human resilience. Let us, therefore, choose witnessing over wielding power. In refusing the pharmakeia paradigm, we dismantle the architecture of control and reclaim healing as the profound, messy birthright of the human spirit. Only then can we claim to have truly cared.